primary takeaway is that, well, first acknowledging that with COVID-19, that we have all experienced our um, various different emotions once we hear that word, whether it's something that you have dealt with more personally and you have a much stronger emotional reaction to that, to where you're dealing with it more indirectly, or even in the landscape on TV versus not, with the multiple different things that it has been sort of coupled with in the political landscape. Many of us at this point have felt some semblance of COVID fatigue. We all have. And I think that we want to first acknowledge that, and then really just trying to take the needle forward and talk about potentially the other components of that and how that can become a little bit dangerous. And the specific component that I'm most interested in really delving into is this feeling of COVID complacency, the sentiment that it's no longer pandemic. And yes, granted, it no longer has that title, but COVID is here to stay. And so how does that really translate in terms of behavioral practices to some of the other diseases that some of my panelists have spoken about that we have vaccines for? And how do we leverage some of the information and lessons that we've learned with various different other disease entities in the past and try to elevate the conversation to say, how do we address the vaccine hesitancy, bearing in mind that there's so much fatigue and things shrouded around the COVID-19 wording per se. So my main concern here is to really speak to the masses, more specifically to us as providers, whether you're a subspecialist like myself, or when I was a general pediatrician, before I became a subspecialist, how do we change the conversation? I don't want to necessarily, quote unquote, blame it on COVID. As you've alluded to here, is that, this concept of vaccine hesitancy is not new. It is not new. But I think it sort of was an opportunity where COVID really was the oil to the gas that really promulgated this issue, which I consider to be sort of the silent pandemic, the vaccine hesitancy. And not so much silent, right? Because we're looking at things like measles, an entity that we were able to stamp out of this country in the early 2000s, and now it's commonplace to talk about measles, a disease that we were able to prevent with a vaccine that was nearly 100% effective. Not 100%, but nearly. Then you talk a little bit further about polio. Who would have thought a polio, the cases that we tend to see are the cases that we see overseas. And because with human trafficking and movement and things like that, we're seeing a lot of those disease entities that were limited to overseas here. Without that herd immunity, we're seeing a resurgence. And so here in New York, which we consider to be the epicenter of all these sort of different infectious diseases, just because of how diverse it is a main concern for me. It's a public health concern that everybody should own.